What's your story?
Shall I start? Yeah. Okay. I am Dr. Henok Zewdu. I am 36 years old, Ethiopian pediatrician. I was born and raised in Addis Ababa, especially a place around French embassy in Addis Ababa. Uh, I I learned there my elementary and high school in Addis Ababa city. Then I joined CUAMM Brescia Hospital, the Black Lion Hospital, which is the biggest hospital in Ethiopia, which is found in Addis Ababa, part of the Addis Ababa University. There, I joined the medical faculty, and it took me 6.5 years to 7 years to be a medical doctor at CUAMM Hospital. Then, in 2013, I just graduated from Addis Ababa University and deployed in rural areas in Amara region. There, I worked for about 1 year. Then I joined Makale University for my pediatric residency. So 3 years in Makale University. I finished my pediatric and child residency in 2016, end of 2016. Uh, when I was a child, I want to be a doctor. If you ask me why, um, uh, my grandfather was sick at that time and he was having hemiparesis. His left side was paralytic, which is so at that time there was no enough medical care, there is no enough medical knowledge in the community. So a lot of traditional practices, traditional healers come to us. They bring black hen over his head and they smoke some leaves just to cure him because they thought it was cured by traditional leaves and traditional methods. But later on, when I grow up, mm, I know that it was stroke in high school. And when I get older, I know that it was stroke. So I want to join medical school and to know more about that. That is the one thing I want to aspire as a medical doctor. That was the ambition. That creates the ambition to be a medical doctor at that time. Later on, after I joined Tukurambas Hospital, even if I saw the case of stroke in my grandfather in the elderly patient, but starting from clinical 1 year, I prefer to spend time with the kids. So they are pure-hearted and they are genuine. So I prefer pediatric patients, kids. So more and more interested during my second year clinical attachment and also in the internship. I work harder in pediatric unit. So that's why I usually when a medical doctor graduated from med school, they have doubt where to pursue in their medical career. But I know I will be a pediatrician because in my clinical years, I have preference for the baby, for the kids. And if you treat them well, you will see their good outcome early and you'll be satisfied. So satisfactory department is pediatric during my internship attachment. So with this, I joined the pediatric. I choose pediatric to be my residency as a postgraduate. Later on, after I graduated from Mekelle University as a pediatrician, I work in Amara region. In Ethiopia, there are many regions, Amara, Tigray, and Oromia. I work in these regions. And 4 years back, in the time of COVID, in the time of COVID, COVID is not, we're not affecting too much pediatric patients. So I have a little bit time at that time, and I see many gaps in the community about health knowledge. Uh, if you Google or if you search for pediatric informations, you'll get in English or some other language. So in 2020, I wrote a book around 150 pages about child health, which is title of the book is in Amharic, Lej Badlu Aidek, in Amharic. There is a famous quote in Ethiopia. Once, if you get a baby, he will raise by fate. His destiny will determine his outcome. So the title of the book is against that. We have to prepare to determine the destiny of the kid. So it's about basics of child health, about starting from the basics of preparation of pregnancy, 300, the first 300, the first 1,000 days, you know that, yeah? Starting from the first 1,000 days, pre-pregnancy care, pregnancy care, and the first 2 years are basics for uh, baby's brain development. So starting from that, about child, about breastfeeding, all basic topics in under 5 children, all topics were covered in that book. So it was, I received a good comment from the community and from the audiences. So I appear many times on national TV to give interview based on that book and to give important message for the community about child health. And with that, so I joined CUAMM in 2022 to Woliso Hospital, St. Luke Hospital. In Woliso, there is a college and a, a hospital in Woliso, around 100 kilometers away from Addis Ababa. So there, I work in pediatric unit, treating malnutrition, treating newborns, preterms, with newborns with infection like sepsis. All this I treat there, and at that time it was for few months. The contract was for few months, but I did great, and because of that feedback, again in 2024, CUAMM has called me, and I joined in Gambela. In Gambela, we treat malnourished child and also uh, area of tropical disease. Malaria and infectious diseases are common in Gambela because it's a hot and arid area, yeah, hot environment. And also there are many refugees from South Sudan. So we'll see many clinical diversification, many diseases. So now I am treating these kids in neonatal, in emergency, and also in malnutrition wards. I treat sick kids. This is how I work.
What is CUAMM?
CUAMM is an Italian organization, which is non-governmental organization, which is mainly for humanitarian action. Currently, in Ethiopia, around 5 areas, CUAMM is supporting mothers and children for better outcome in their health, in their nutrition, and in their life even.
What are you doing here in Italy?
So here in Italy, okay, first of all, I want to thank this support group of the CUAMM, which makes it real for my travel to here in Brescia. So I'm indebted to you. Grazie mille. Thank you. So here in Brescia, I am hoping to attach in the neonatal unit. So in the neonatal unit, even if I work in Gambela, but I will get better knowledge, better skills from much more experienced doctors, and also intercultural differences in the managing clinical cases. That will be important. Also, I will network with better physicians in the field of neonatology. So networking is very important thing, and I will build my capacity through this process. And when I go back, I will add value in the management of the newborn, in the colleagues, and also in the community. I hope like that.
I would like to start with a personal observation. After the COVID-19 pandemic, it seems to me that people in Italy, as in the other country, I don't know, such as the United States, have less trust in medicine and the doctors, in part because of the vaccine debate. Do you perceive a similar situation in Africa?
Normally, because there are a good vaccine coverage here in Italy previously, maybe. But in our country, we have 20-30% of vaccine coverage. So whether in COVID time or now, we didn't achieve what we want. So it's not solely to the COVID. There are multifactorial problems regarding the vaccine, but after COVID, now especially when the time has passed, people are coming back to hospitals. Yeah.
We've been told you have a TikTok page where you share educational content.
Also, there is also a rumor like vaccines are causing autism and like that. Such kind of topics are I raised in my TikTok. One thing I forgot is I have around 53,000 followers in TikTok. So I raise mainly child health topics. So in Ethiopia, rather than YouTube or Instagram, there are many audiences in the TikTok. So I have 53,000. So such kind of doubtful topics, I will clarify for the community. This is very interesting. Yes. So
What are the government's current policies on vaccine and healthcare coverage for the population? And are there any advocacy projects or political initiatives aimed at expanding access?
So one of our projects in CUAMM is helping the surrounding vicinities. And our main work is in the city of Gambela, but we support waredas and vicinities to vaccinate enough children. There are many governmental policies. One thing is every child who come to hospital should be checked whether his vaccine is up to date or not. The other thing is we have campaign. So every time when there is outbreaks like measles or any other outbreaks, they go to school, they go to the community, and vaccine campaign is the other thing. And also NGOs like UNICEF. They are helping a refrigerator, which is worked by solar, because in rural setup, there is problem of electricity. So solar powered refrigerators are widely available because of UNICEF. So these things, and also whenever there are dropouts from vaccines, the health extension workers, they go to home or we register their phone number. They call the parents to bring them and to finish their vaccination. But these things are working a lot, but still it's not satisfactory, the vaccine coverage.
Now that you have seen Poliambulanza, which is a modern hospital equipped with cutting-edge medical technology and highly trained personnel, what difference do you notice compared to Ethiopia?
Okay, there are many problems in Ethiopia. One thing, starting from the infrastructure, especially when I am working in Gambela Primary Hospital, which is a small hospital, but the refugees prefer that. So it was crowded hospital. One thing is the infrastructure is not good. But mainly, the main factor is not giving a satisfactory service in newborn unities. There is not enough manpower. We have shortage of neonatal trained nurses. But regarding medical equipment, again, comparing to ambulancia, it is far behind, but is enough for us. But the main thing is we don't have well-trained clinical nurses or neonatal nurses. Well-trained neonatal nurses, yes. In Ethiopia policy, neonatal nurse, they should go to university and they should study 3 to 4 years to be a neonatal nurse. So we have shortage of neonatal nurses. And still, we have like we do, if you know neonatal ICU, CPAP machines and others, we do it locally. And incubators in polyambulancia, they have many incubators. Every kid is in the incubator, but we have only two incubators. So sometimes we prefer to put the other one from the other one. So medical equipment wise also we have problems. So these all things are different from polyambulancia.
What do you think are the main priorities at the moment regarding perinatal and neonatal public health initiatives?
Ethiopia has achieved the Millennium Development Goal in reducing the neonatal mortality, but still, sometimes it is waning and waxing. It goes up and it goes down. So we have to do a sustainable job in the neonatal ICU. So one thing is training nurses, enough nurses, because neonatal care is mainly nursing care. So training enough nurses, availability of drugs like caffeine, surfactant, if you know, important for prematures, availability of such drugs, and infrastructure-wise, usually there is no building or a structure which is meant for neonatal ICU. Simply, we just allocated to some of the buildings, not meant for neonatal ICU. So this whole factor should be improved. And also oxygen-wise, we don't have oxygen plants. So we use concentrator or cylinder oxygen, which is difficult for us.
What's your day-to-day life in Ethiopia?
In Ethiopia, yes, in Ethiopia, suppose it is Monday or like today, Tuesday, morning in Gambella, Ethiopia. So Gambella, Ethiopia, I woke up around 6:15. So 6:15, then I do my cleaning and I do my self-hygiene. Then at 7:30, I go to office. CUAMM office is nearby. So I go to CUAMM office and there are midwives, clinical midwives, who work with me, who are a staff of CUAMM. So the car will take us to the primary hospital. At 1:30, 1:45, we reach to the hospital. Then usually in the morning time, I did a round in neonatal ICU. Also in malnutrition ward, usually. Suppose average, we have 10 neonatal patients, around 10 neonatal patients, and around 20 malnutrition patients. So I did a round, and then in emergency unit, if they have consultation, and also in outpatient department, if they have consultation, I will go there and I will help them. Until 12:30, I will do that. And until 8:30, until 2:30, we have a break, 2 hours of break. Then in the afternoon, I will revise in the rounds, the orders with the nurses. I will revise what we are discussing in the morning, in the afternoon until 5:30.
Considering the importance of perinatal mental health, which is often regarded as a particularly sensitive area, how is this aspect addressed and implemented within your department or unit?
Yeah, mental health issues are in our country, they are like luxury. Yeah, it's not widely available. Even if the mother feels depressed or if she has postpartum blues, the community or the family will blame her. Oh, why do you do like that? As if she do it on purpose. So mental health issues, especially in postpartum, the service is poor. Even we face problems in breastfeeding, in attachment with the baby because of these mental health issues. So still, there is many gaps in mental health issues. Regarding the premature cares, we advocate skin-to-skin care, kangaroo mother care, but usually because of lack of knowledge and because of the weather, the mothers refuse to do the skin-to-skin care. But if we have enough incubator, we put them, but we have only 2 incubator, so we prefer the most critical one to be in the incubator. Regarding the skin-to-skin care or kangaroo mother care, we have many problems. It doesn't need any infrastructure, it doesn't need any equipment, but there is attitude issues and also the weather. That's a problem we face. The other thing, the mental health issue, it is poor service.
Following up on that, how would you assess the success rates you've achieved in supporting the families of new mothers and their babies, especially when dealing with individuals who may not fully understand the complexities of perinatal mental health and postpartum depression.
Yeah. As much as we can, we try to give a respectful and compassionate care, especially in postpartum period. We should be compassionate with the mother. And we try to tell the mother every step we do, but still on that part also we face problems because, as I told you, we have shortage of nurses. We try to tell them, but still we have gaps on that. But we are trying to manage it.
Are you adequately supported by mental health professionals in your field?
Usually I don't spend time in the obstetrics ward, but there is a there is a psychiatric nurse in the hospital where I work, but I hope he supports some of them, but not satisfactory, not good, not enough.
What advice would you offer to the future generation of doctors?
Currently, young people are not into the stream of medicine or careers who need strong work, but I hope that's not appropriate. Youth or the youngsters should join medical school, especially advocate them to join medical school. They help people, they alleviate their pains, they cure patients, and they will get many satisfactory. Even joining medicine will make you proud, will make you happy. And after all, life is not about always getting something, but also giving service and sharing what you know to others. So for the youngsters, especially with the social media era, it will be difficult for them to join a career which needs enormous effort, but I should advise them to avoid shortcuts in life and to take a long path in life and to be strong and to have a life for others also, not for theirs.